Hello, I'm John Robinson from Turnaround Tuesday. I'm the job developer. And hello, Turnaround Tuesday participants. I'm going to read the higher purpose. Your misery is your ministry. Your pain is your purpose. Your suffering is your service. Your mess becomes your message. Your test becomes your testimony. God allows us to hurt to heal others because you cannot heal what you cannot feel. So don't let the pain of your past punish your present and paralyze your progress and purpose. As I think about that, I think about the fact that it's been a year since we've been in this pandemic and been dealing with this. And it is good to see that. I know we have lost a lot of suffering, a lot of losses in this year. But we have been trudging on, and it looks like there's some light at the end of the tunnel. And as we talk more about it today, I'm feeling pretty good about what it looks like. It looks like some daylight because it's been a really, really tough year. But we have been at Turnaround Tuesday still trudging on, getting folks employed. And so I'm feeling good about that. To do all of that, we've been still working hard. And I'm looking forward to our next endeavor. And now I'm going to hand it over to Melvin, who will give you a little more about what's going on with us.
Hello, Turnaround Tuesday. And I know it's the second week in February, but Happy New Year. This is our first recording of 2021. We're excited that we're re-engaged with you. I hope everyone had a good 2020 in spite of what we as a nation have been dealing with. But just know your Turnaround Tuesday family's here. We're engaged. We're ready to continue to do this great work that we've been doing over the past 6 years. I just want to again let you know that we're keeping each and every family in prayer during this time. We know that not as a nation, as a state, as a city, all of us are dealing with this as a collective, and you are always in our prayers. We do continue to have our food giveaway, working with our partners at Build. Every Wednesday, we continue to do food distribution. If you're part of that, that will continue. We also are continuing to do our COVID relief help. We're helping folks out that may have emergencies. If you have an extreme emergency, we ask that you reach out to our case managers and we'll see if there's a possibility that we can help out. So know again that we're completely engaged. We're glad to be back. And with that, I'm going to turn it over to our Director of Operations, Bree Johnson, with some updates.
Thank you, Melvin. Greetings, everyone. So as Melvin stated and John stated, we are still moving full speed ahead. Thus far, overall, Turnaround Tuesday, we have 933 job placements, with over 212 alone for 2020, and 176 of them during this pandemic. Every Monday, we have our orientation for those who are interested. We stay in contact with those who are in their process, and we constantly reach out to those who are still employed, each and every time trying to build a stronger relationship. So please be sure to check out our website at www.turnaroundtuesday.org. Please reach out to any one of us as staff to find out more information or where you are in your process or how we can help you. All right. So next up would be Michelle Benjamin Jones, who is our case manager, and she'll share the spiritual vitamin. Michelle?
Hello, everyone, and welcome back to Turnaround Tuesday. Today, I'm going to discuss Rebecca Lee Crumper. In 1864, Rebecca Lee Crumper was the first African-American woman to become a medical doctor in the United States. She was also an author, which was unheard of for women at the time, but especially for African-American women. She wrote a book about her medical journey, and it was phenomenal. Many people got a lot of knowledge from it as the years went on. Initially, obviously, it wasn't very well received. She practiced medicine in Boston, and she was able to work primarily with poor women and children. She was able to treat them effectively because she had knowledge of her community, and she knew what their needs were, because at some point, she was them. At that time, many male physicians had the belief that women's brains were 10% smaller than theirs were, which is, to us, seems incredibly wrong, but this was the belief at the time. So not only did they hold her gender against her because they felt like she was inferior because her brain was smaller, but also because of her race. And so she had to go through so many obstacles to even get to the point of graduation. They tried to overshadow her by going against her prescriptions for her patients. They tried to not listening to her input and did not allow her to have a voice at all. Despite all of this, she persevered and she kept working diligently for the people who she felt needed the most voice. This quote that I'm about to show is really the mantra of Rebecca Lee Crumper's life. Okay. She believed that selfish prudence is too often allowed to come between duty and human life. What that meant is that this quote is to inform us that we need to put aside our selfish desires and our areas of caution about our own selves and address the greater public good. Rebecca Lee Crumper, continued to live by that standard until the day that she died. She helped people despite the needs, she helped people's needs despite the cost to herself, which I think is phenomenal, specifically in 1864. I can only imagine how difficult things are now for any woman to become a doctor. You know, it's still not easy, but for her specifically at this time, it was probably the most difficult task she ever had to undergo, and she did it very well. So with that, I pay homage to Rebecca Lee Crumper, and I turn it over to Terrell and Dr. G to inform us a little bit more about medicine.
Thank you so much, Michelle. And it is great to be back again doing another recording. Again, as our co-director said, Happy New Year. We have another chance to get it right. And thank you, Michelle, for that great honor for Dr. Crumpler, the first African-American doctor in our country. And now I want to introduce another doctor in our country, and that's Dr. G. And Dr. G has been a friend to Turnaround Tuesday for quite a few years, about 4. We met Dr. G about 4 years ago. And there was something about him. Sometimes we come with perceptions about people. And, you know, I thought doctors were like different kinds of people or something. I mean, I don't know what I thought they were. I just thought they were different until I met Dr. G. And, you know, just like anything else, when we meet people, you know, it demystifies the barriers we put up. And I'm so glad that I met Dr. G those 4 years ago. And he's been a great friend to Turnaround Tuesday, certainly not because he's a doctor, but because what that doctor does. And so he's here today to share with us, you know, how he sees not only medicine, but health. So with that, Dr. G.
You know, Terrell, I truly appreciate it. In all of our lives, there's always moments that stand out to us. So who I first met from Turnaround Tuesday was Melvin at Cups on Broadway. I remember where we sat close to the window. I remember your leather jacket that you wore. I remember the jokes that you made. I remember you laughing at some of mine, even though they weren't good. But I was like, that's a courtesy laugh. That's very kind. You know, and Terrell, those are incredibly kind words. Just so you all know who I am, so you're like, who is a stranger talking to me still? I go by Dr. G just because my birth name is Panagis Galiatsatos. And I love that name, don't get me wrong, I'm proud of that name. My grandfather, who died in World War II fighting Nazis, carried that same name, right? But who am I, just so you guys know a little bit as well? I'm a son of immigrants. My parents came here in the 1970s. Actually, I always laugh, while I'm a physician at Hopkins, the first time they rejected me was at birth. My mom showed up, I didn't speak English, they turned her away. So I grew up in a heavy immigrant neighborhood in East Baltimore. And what that neighborhood taught me was that your community can help in many ways, right? We're all individuals, we all have our strengths and weaknesses, we know that. If you're in a community, those weaknesses can be hidden or kind of put to rest with a strong community, with people who care and are invested in you. My dad was a union painter. Many homes he painted, if they needed, hey, the wall's chipping, do you mind just coming over, Jerry? My mom was seamstress. Many pants, many prom dresses I remember her making, not for me, for sisters, cousins, and so forth. Your community did that. Your community was there. And I say this because that's what Turnaround Tuesday is built with you all, a beautiful community to promote health and prevent disease. And I say that lovingly because when we say health, you may think of me, a physician. It's not the right way to think of it. We do medicine. That's what we go to school of medicine. However, we become dubbed as gatekeepers of health. I think it's a little bit of an error because medicine and health are not the same. Health should be an identity, family, people who love me, walking to the park, or just enjoying your home, having a job, having a feeling of necessity. And that's what community provides. And to me, that's health. And I say this because I've always carried that mentality. And as I told Melvin and Terrell, I don't view myself as a doctor, hopefully no different than my dad viewed himself as a painter, or my mom as a seamstress. And we're just community people who happen to be seamstresses, painters, or doctors. And that to me is the most powerful thing, because Baltimore means something different for all of us. Whether it's our ethnicity, our language, or the color of our skin, it means something different from all of us, and that's our narrative. But most importantly, coming together for a greater good, that's where Baltimore excels. I always laugh, my parents could have gone anywhere. They came to Baltimore. And I love this city for that reason. I love it. It's given me my identity, and it's given others its kind of purpose in finding it. To me, that's Baltimore's best resource, not the Ravens or the Orioles, it's the people. So I say this because I'm coming to you with, you don't need me to come to you and say, hey, we're in a pandemic. You know this. Our lives have been upended. I get it. What I'm coming to you is to emphasize two things. One, we still need those hygienic interventions. What are those? Staying far apart, face masking, and hand hygiene. I say this lovingly because it's easier said than done, and I don't say this in a manner where go out and do it. Today, I ran a post-COVID clinic, and 3 of my patients, actually all 3 Northwest Baltimore citizens, all of them said, they're like, I thought it was doing all the right things to not catch this virus. And I say to them, like, you can do all the right things. Mother Nature's different. We do all the right things to protect us. Just like wearing a seatbelt in your car and driving at the speed limit should lower your chances of getting into a car accident, but doesn't take them away. So from my standpoint, these hygienic interventions, we still need to continue to promote them. It's what's going to keep us from catching the virus and keep us safe. The best way, honestly, to beat COVID-19 is to just not catch it at all. And for those who have caught it, Mother Nature is very tricky. We've already seen reinfections happen. So we've got to still be on our guard to protect not just ourselves, but the community. I mean, this virus really emphasizes how much we need the community now more than ever, because you can do all the right things, but if everyone else isn't, you're going to spread the virus. So work with your community, work with others to fight this. I say this lovingly because we've seen 2 other coronaviruses in the past, 2003, 2013, not in the US. Southeast Asia, Middle East, 2 bad coronaviruses emerged, and they went away, not with a vaccine, not with a cure. They went away with face masks, physical distancing, and hand hygiene. So I say this again, easier for a doctor to say, I get it. Work with us, work with your leadership at Turnaround Tuesday. What are the barriers? Is it a job? Is it allocating resources and food? Is it actually getting the face mask? Work with us. Everyone wants this pandemic to end. And just like I've told a 5th grader in our COVID curriculum, when they asked me when will this end, I said it will. It can go away in 4 weeks if 95% of the people did these things compliantly. And I can say that with confidence because we've seen other countries do it. Finland, New Zealand, Australia, Singapore, they've done it. So we can do it here as well. At the same time, we have had science give us a vaccine. And the way I'm hoping you all look at science is no different than listening to the Supremes put out a beautiful song. I'm saying it, God rest her soul, one of the founding members who recently passed away. But art is something mankind has put together. Science is something mankind has put together as well, right? It is our outcome. It is us kind of defying the odds and defying Mother Nature. And that's what a vaccine is, essentially. It's allowing us to have immunity, and I'll go over what that means, without ever having to go through the disease. That's powerful, right? I say this lovingly as well because everyone here looks young, but you guys all look older than 18. Why am I saying this? Your immune systems, that system that's meant to fight off infections, will always be at its best when you're young, right? Up until 18, maybe 20. You throw out things, it's ready to go. It's ready to go. It's ready to rock and roll. That's why we've always seen, especially with COVID, the young, not that big of a deal to them. Their immune systems are awesome. But when we get older, and everyone here looks somewhere between 18 and 21 in this video.
Or what are you calling older, sir?
Yeah, I said 18 to 21, 18 to 21. When we get older, our immune systems, it's not that they're not good. They're just relying on memory. They're relying on a playbook, right? Could you imagine if Lamar and John showed up to play the Steelers without ever reviewing the game plan? They'd lose. Our immune systems are the same way. They rely on what they've seen in the past to fight off infections. They're not good against new things. They really aren't. So one way to get a playbook is to just get the disease, suffer through it, battle your life, and then you get some level of immunity. No one wants to do that. No one wants to lose 3 months of their life fighting the ag in the hospital or the vaccine. You get immunity, never having to be hospitalized, never having to miss a day of work, go on with your life. You may feel achy, don't get me wrong, I'm not taking that away. I felt bad for about 8 hours, sweatshirt on, drank some tea. But this is a man-made outcome that is just, it kind of dupes Mother Nature. It puts us one step ahead of her. So the vaccine doesn't come without skeptics, as it should. It's a new intervention. Dr. G, I'm a human being, just like my parents. I got concerns. Let me tackle 3 of them to help put your minds at ease. And keep in mind, I'm not a salesman. I'm giving you information that I'm hoping you can take to decide what's best for you and your family. And I say that because I'm fully aware that the promise of medicine has been broken for many populations. Based on race, ethnicity, language, I get it. I can't undo the past. I can't. I come at you as a doctor. No, I come at you as a community member who happens to be a doctor to share this information with you. And you can begin to write a new chapter with us, right? Make medicine be accountable. At the same time, use some of its advantages and resources if you agree with that. So 3 things about the vaccine, hopefully to give people peace of mind. A, that I hear, was this rushed? Did we cut corners? Actually, it wasn't. And to some extent, you could say it's actually rather slow. When a new infection emerges, it takes time for us to kind of understand its anatomy of the virus and understand what's unique about it that we could potentially target for a vaccine or a cure. Well, you heard me earlier say there was 2 other bad coronaviruses that came out. They didn't become pandemics. They became public health concerns, but they also started vaccine trials, 2004, 2014, about a year after they emerged, where people actually in early phases of the research trials in the laboratories got jabbed in the arm, right? There's people walking around with a coronavirus vaccine in them up to 17 years. Why do these vaccines come to light and leave the research world? It's because, again, like I said, those vaccines went away. I'm sorry, the virus went away. The virus went away with those hygienic interventions. However, we learned a lot. So we learned, documented it, put it on the bookshelf, ready to go if another one emerged. 2013, Middle Eastern Respiratory Syndrome coronavirus emerged. All right, the vaccine trials actually went into even phase 2. We got much further because we had all that insight from SARS-CoV. But again, the hygienic interventions work. We put all the knowledge away. SARS-CoV-2 comes out, right? The virus that causes COVID-19. We're ready to go. This is, as one virologist or vaccine specialist said to me, he's like, it's literally like tweaking your mom's recipe. It's worked for years. You can make one little change, it's ready to go. That's it. So if this was the first time coronavirus has ever plagued human beings, yeah, we would be waiting a little bit longer. But as life should have it, as God should have it, we learned from our past, ready to go with this one. So we didn't cut corners. And actually, once we got into the research trials to go from phase 1, phase 2, phase 3, this is what I love about the world. Going from each phase takes about $20 to $50 million each phase. Now, I don't know if Melvin or Terrell have ever tried to raise $20 or $50 million. It doesn't happen overnight. It actually takes about 3 years. So the way we got here fast was A, the world pledged all of its economic resources to medical centers, pharmaceutical companies. And 2, all right, that's fine, but you still need intellectual people to work on the coronavirus. So what ended up happening was everyone's laboratories, when they worked on other vaccines, they stopped. The largest, for instance, the largest HIV vaccine laboratory is here in Johns Hopkins. Dr. Bumpus, she's amazing. She hasn't worked on HIV in over 1.5 years. All this intellectual capital went to work just for this coronavirus. So economic capital, intellectual freedom, all of it we got. And literally all you did was move at the pace of science, which again is man-made. We created it. No different than creating Zoom or creating an amazing song by the Supremes, right? We created this. We moved at the pace of science, and I'm hoping there's some lessons we learned to kind of allow science to move at this great pace to meet up people's demands. Second, I hear this a lot. Yeah, doc, but was this just research on people that don't look like me? This hits home to me, right? Son of immigrants, that means a lot to me. My best friends, colleagues, my neighborhood of Baltimore, we're diverse. And what I can actually say and sit back is, the answer is yes. I applaud a lot of these research groups. They recruited 10% African Americans, 25% Hispanic or Latino, 40% individuals from just socioeconomically disadvantaged areas. They recruited people that look like those getting ravaged by COVID-19 in order to say, will it work for them? That's powerful. I say this because if you pick up any other research trial, right, anything else, nowhere does it even crack more than 3% people that aren't white and affluent. So I really applaud people to put a health equity lens on this. And then third, and now I see this because a lot of attention's been on COVID. People are like, all right, we got all that information. We recruited people that look like those being impacted. How well researched is this though? Right, I still get that question. And what I can tell you is, of all the COVID-19 research for interventions, let's go through the big ones. The antibody, the one that former president got, right? President number 45, that antibody, right? 400 people have been recruited for that research. That was it. He was one of them. What about remdesivir? A medication never used before, ever used before. First time it's being used. Like, we don't even know long-term consequences of this. This trial's recruited about 1,000 people globally. That's it. And we even followed him for 28 days. That's all. Then the steroids, hydroxychloroquine. Again, all of these research trials for COVID-19 interventions, 1,000 people, no more than 28 days did we follow them. The vaccine, Pfizer recruited 44,000, Moderna 45,000, Johnson & Johnson another 45,000, and followed them for a minimum of 3 months. We're going to follow them up to 6 months. Like the vaccines are the most well-researched COVID-19 intervention to date. And if you're curious, hey, will this have long-lasting side effects? Well, those coronavirus people that got the coronavirus vaccine individuals who got it back in 2003, 2013, they're walking around perfectly fine. I know this because that data is publicly available that we can review. So be skeptical, 100%. Come at this with a mistrust because medicine's past has been broken countless times. Don't, like, you are who you are. I get that. At the same time, here's the information. Make the best judgment for yourselves, for your community. If you feel like this is on par with who I am, then promote the science to promote health and prevent disease. And the last closing thing I'll say about the vaccine. If you get it, the vaccine, it provides what's called sterile immunity. What that means is you may still get the virus, but you will never get the disease. It prevents disease. That's what these vaccines are intended for. It's just looking to prevent disease, right? It's like saying, like, I got an HIV vaccine to prevent AIDS. That's what it's looking to do. You may get SARS-CoV-2. We're just trying to prevent you from getting COVID-19. If a lot of people in the community get it, 80% or more, then you can achieve what's called herd immunity. What is that? That means at that point, the virus may no longer be able to spread. And I have to emphasize that because the vaccine isn't just for you at first. You're realizing it's for everyone else too. Because you got to understand one last closing comment about viruses. If I want to make more humans, humans get together, we make more humans. If a cat wants to make more cats, cats get together, make some more cats. If viruses want to make more of themselves, they got to get into us. Like, a virus can't make more virus by itself. It needs us. It needs us. So if this virus comes into me and it's like, oh, he's got immunity, can't do my business here, leaps out potential into someone else. Maybe he goes to Terrell. Terrell's got the vaccine. And suddenly it's like, oh, I can't make more of myself here. I'm going to go to Melvin. Melvin's got the vaccine. At some point, just like everything else biologically, it dies off. So if this virus can't find someone who hasn't been vaccinated, it goes away. That's herd immunity. We can only achieve that if enough of us got vaccinated. So I say this because the shot may seem like it's just for you, but it really is for everyone else. And then one last thing, I keep saying that, I apologize. For you all are all recognizers of greater being beyond yourselves. Turnaround Tuesday to me is the ideal gold standard of what a community means, bringing people for a greater cause. To end this pandemic, it's going to take us realizing that. Do it for yourself, do it for Jasmine, do it for Thomas, do it for Michelle, I get it, but also recognize you're doing it for everyone else. Don't change the past, we can't, but we can write a new future together. So over to you all.
Well,
Thank you so much.
first,
Can I ask a
thank
question
you,
to, Dr.
thank
G?
you, thank you.
So a lot of our participants have children, and you know they're all right now doing virtual learning. Do you, as a medical professional, do you recommend our kids to go back to school?
This is a tough question. And I say this lovingly because you get this research coming out of the CDC that said, hey, schools are not super spreaders. But my reaction to this, I was having this conversation with Stuart Hill the other day, Stuart Hill Academy, and countless others, Hazelwood and so forth. I've had the ability to go into a lot of these schools virtually throughout the nation with our COVID-19 curriculum, from San Francisco to Rochester, New York. The schools that have gone back have a lot of economic resources. Like the kids in there are like in their own private booths with like face masks, you know, they're making it rain in there. I say this because, yeah, these schools aren't super spreading events because they're well funded, they were well resourced. And my heart breaks is because I love the city, schools in the city. I don't know if our schools have the resources like that. So what I would really pledge is the first thing before we discuss, like, I want our kids, look, trust me, I want my daughters in school. They're pulling my hair out. But my first plea is first, let's get our community under control. Because the best way to not spread COVID in the schools is to not bring COVID into the schools. If you do that, schools will be safe, right? The best thing about Baltimore is we've done a lot with a little. And my fear is, you know, this pandemic's here, a lot of things haven't changed, right? We still struggle, I get it. So I want kids in school, yes, but I want them in safely. I want them in where schools are getting resources to keep them safe and keep the teachers safe. Both of those, if those can happen, yeah, you'll get my blessing just like you'll get a lot of other people's. But I really want to make sure my frustration about that CDC paper is that's a biased group that you looked at, and it should be emphasized. It's not your Chicago urban schools. It's not your Baltimore City urban schools. And like we did this with Rockaway, New York, right? One hospital, they've been ravaged. They're like, how are they going to? We don't have the resources for that. So that's my 2 cents. The answer is yes, I want them back in, but safely.
And that sounds like the difference between a doctor of medicine and a doctor of health. That sort of explanation, right? Any other questions? Any other questions? Thank you so much, Dr. G. Again, we called on you 2 weeks ago and you're like, whenever I need you, I want you to know we're going to be calling you again.
By all means, this is bi-directional. Like I'm on your team. I'm part of your team, whether you want it or not. I'm a community member of Baltimore till the day I die. Like that, you guys got me. So
thank you so much. And now Ms. Tylia Reed wants to come and give us some resources. Tylia.
Yes, thank you. Thank you, Terrell. And thank you, Dr. G, for the awesome presentation. Great information. I just want to provide some resources for COVID testing and also for the COVID vaccines. We hear a lot on the news about where can we go? What is happening? What are the new things that are happening within our city? And so, as we know that the Baltimore City Health Department appointments are currently booked for individuals to receive their vaccines. However, for adults that are older, 65 and older, and have access to the internet, can complete their interest forms and online, or those that do not have access to the internet can contact the Maryland Access Point, and that phone number is 410-396-2273. And individuals who would like to sign up for the COVID vaccines, they can also visit the coronavirus maryland.gov, and on that site, you'll be directed to where you can have testing in your area. The majority of the areas have a waiting list, but feel free to still put your name on the waiting list. For individuals that work in hospital settings, reach out to your employers to see where are they doing the vaccine, the COVID vaccines. For individuals that are living in long-term care facilities, they are being vaccinated at CVS and Walgreens facilities. And all this information that I spoke about will be posted on our website at turnaroundtuesday.org, and we will upload the resources directly there. So if you have any questions, and have a good day, stay safe, everyone.
So I think, do we have Thomas next?
Yes,
Yes.
and Thomas will pass that over to Thomas for the prayer.
Amen. Before I get started, I'd like to say that we believe, or we honor and respect every religion. We honor and respect those who choose not to have religion. But as an organization, we like to go and pray to our God for all that he has done for us. So I ask that you bow your head. Father God, who rules and super rules this universe, we come to thank you for this time that you have called us together by your Spirit. To thank you, oh God, for the wisdom that you have allowed us to express and allowed us to receive this day. Thank you for the spiritual vitamin to know that Dr. Crumpter was a trailblazer to allow many other people to come behind her and become doctors. It amazes me, oh God, how you was able to perform that miracle even while slavery was going on. We thank you for Dr. G, for causing him to come here today to set aside this time to promote his hygienic intervention, to let us know that we all must play our part. We thank you for the vaccine that was created to bring about healing in this nation. We thank you for Dr. G and using him to ease our mind, to let us know, oh God, that those vaccines were not rushed, but the proper research was done on our behalf. We thank you, oh God, for letting us know that no corners were cut and for the diversity of testing. We ask you, oh God, that you continue to just bless us even as you separate us one from another, and we will be blessed. In God's name we pray. Amen.
Amen. Thank you, Thomas, for that wonderful prayer. So, Turnaround Tuesday, the whole of last year, we asked, anytime we brought you this beautiful video, we asked that you put something that you're grateful for in a gratitude jar. Okay, I hope you can see my gratitude jar. So today, we're going to take 2 or 3 things out, briefly, real quick, to see what we've been putting in all along in our gratitude jar. So the first thing I have here is, I am grateful for my daughter. The second one is, I'm grateful for life. And then the third one says, I'm grateful for family. Let me just talk about life real quick. Why am I grateful for life? Because believe it or not, gratitude is the way you see things. I am grateful to even be able to breathe, because I know that not a lot of people have that opportunity to breathe. If you're able to come to this meeting and make a video and even know how to use Zoom, it's a blessing. I'm grateful for all that. So I'll pass it on to Cheryl. Cheryl, what are you grateful for? What did you put in your jar?
Thank you, Michael. You always uplift me with your voice. 2, first one is relationships that ground me. I lost my mother this year, and the relationships that I had cultivated outside of work and very much at work really sustained me. And this whole team made a video for me that I play every once in a while when I'm feeling low. And I really appreciated that. So the relationships that keep me in life well. And my second one, interesting for today, was human curiosity. That there was enough curiosity to invent things like virtual worlds so that we could do this. The human curiosity that came with the development of vaccines and tests, certainly what we heard about today. So I'm just grateful for people that throw themselves all into that work. And I think next is Jasmine.
Yes, thank you, Cheryl. So I also have two things. So my first is to have all of my family and friends that are still with me. I have a 93-year-old great-grandmother that is still around. And this year will be, God willing, her 94th. So, you know, it's just a blessing to still have her there. And also my grandmothers and grandfathers also. And I also have right here that I'm also grateful to not have been affected by COVID. I have had some family that has been affected by it. Some were asymptomatic, some, you know, that actually went through the motions of everything. But I'm just very grateful that I have not been affected by it. And that is my two things. Those are my two things I'm grateful for. So next is JC.
Well, thank you, everyone. So my three things is the same as Michael. One is life, and with life, last year I had experienced several deaths back to back with my family, and it just, you know, brought everyone together in light of COVID. And you know, some passed with COVID, some did not, but to just never take life for granted. If you're able to take a breath, just at least say thank you, thank you, thank you, thank you. And my second one is for my daughter. I've learned patience and understanding due to COVID and having to have your child go to school from home, and to just see how much of me is in her that I can't take sometimes. So it's just, she just taught me a lot of patience and understanding. And my third one is my home. Thanks to Turnaround Tuesday for allowing me and, you know, giving me the opportunity to actually still provide a roof over my daughter's head. And some, you know, some people take that for granted as well. You know, during this pandemic, some people don't even have a home to go to. And again, that's something just to be so grateful for and an honor for, just to say thanks. So those are my three things that I have in my jar.
Wow, thank you all, very powerful. Usually we end with exercise, but today we are not going to exercise. We just want to say we love you. And Tara, do you have anything to say?
Why we're not exercising?
Okay, let's go. Dr. G, let me tell you, after all our recordings, we exercise. So 5, 4, 3, let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. We love you. Turnaround Tuesday. Thank you.
Thank you.
Thank you, Dr. G.
Thanks, Dr. G.
All right. Bye, everyone.
Bye.
Thank you.